Hi, it's Lorelei. Welcome back to my channel with up-to-date news and resourceful information on mental health. If you are new to my channel and you find the videos helpful, don't forget to hit the like button down below. Let's get started with the second installment on the news for the week of October 11th. Most Canadians believe Facebook harms their mental health, according to a recent survey. A broad swath of Canadians has a sour view of Facebook, with half respondents to a new poll saying it should be regulated or broken up as a corporate image. Crisis rocks the social media giant yet again. 40% of those who responded to an online survey by Leger and the Association for Canadian Studies said they had a negative opinion of the company. The vast majority also agreed that Facebook amplifies hate speech, helps spread fake news, damages individuals' mental health, and poses a risk to children and teenagers. However, more than 3 in 4 believe the social network helps them stay connected to their loved ones, with just over 50% saying it is key to sharing information and positive for free expression. Conducted on October 8th to the 10th, the online poll surveyed 1,545 Canadians and cannot be assigned a margin of error because internet-based polls are not considered random samples. Leger Executive Vice President Christian Baroque says Canadians maintain a dependence on Facebook, but not a strong affection for it, as the platform confronts intense public scrutiny over how its algorithms fan inflammatory rhetoric and affect users' self-esteem. There's sort of an "I need you, but I don't love you" relationship, Baroque said in an interview. Facebook really has a corporate image problem now that they will need to face. Last week, Facebook whistleblower Frances Hogan testified before a United States Senate committee that the company's products harm children and fuel polarization in the U.S., a claim supported by internal company research leaked to the Wall Street Journal. Facebook is starting to be an onion. The leaks were basically just one more layer, Baroque said. He highlighted the platform as a space where supporters of then-President Donald Trump called on citizens to storm the U.S. Capitol in the lead-up to the January 6th insurrection. A single event is never enough to destroy a company, but a series of events, then it becomes something, becomes like a snowball. She opens the app and gets bombarded. Parents on Instagram, teens, and eating disorders. Early in the COVID-19 pandemic, Michelle noticed her teenage daughters were spending substantially more time on Instagram. The girls were feeling isolated and bored during lockdown. The Arizona mom, who has asked to be identified by her first name to maintain her children's privacy, recalled, "She hoped social media could be a way for them to remain connected with their friends and community. But as the months progressed, the girls fell into pro-diet, pro-exercise, and ultimately pro-eating disorder hashtags on the social media app. It started with health challenge, photos and recipe videos," Michelle said, which led to more similar content in their feeds. 6 months later, both had started restricting their food intake. Her eldest daughter developed severe anorexia and nearly had to be admitted to a health facility, Michelle said. Michelle attributes their spiral largely to the influence of social media. "Of course, Instagram does not cause eating disorders," Michelle told The Guardian. "These are complex illnesses caused by a combination of genetics, neurobiology, and other factors. But it helps to trigger them and keeps teens trapped in this completely toxic culture." Testimony from the Facebook whistleblower Frances Hogan last week revealed what parents of teens with unhealthy eating behaviors due to body image fears had long known. Instagram has a substantial negative impact on some girls' mental health regarding issues such as body image and self-esteem. Internal research Hogan shared with the Wall Street Journal found the platform sends some girls on a downward spiral. According to one March 2020 presentation about the research, 32% of teen girls said that when they felt bad about their bodies, Instagram made them feel worse. Facebook has disputed the characterization of its internal research on Instagram. It is simply not accurate that this research demonstrates Instagram is toxic for teen girls, the company said in a statement last month. The research actually demonstrated that many teens we heard from feel that using Instagram helps them when they are struggling with the kinds of hard moments and issues teenagers have always faced. The company has also criticized the internal presentation that the Wall Street Journal reporting was based on. In light of the revelations, Facebook announced it would be pausing its Instagram Kids project and building parental supervision tools into the app. The company also said it would introduce features encouraging young users to take breaks from the app and nudging them away from harmful content. But parents of teens with eating disorders who spoke with The Guardian after Hogan's testimony said that finding out that Instagram's parent company had research on Instagram's impact had been infuriating. They are responsible for triggering serious eating disorders in many individuals, Michelle said about Facebook. And after what we learned this week, it is evident they don't care, as long as they're making money. Importance of housing for mental health highlighted on October 10th. Individuals and organizations recognize World Homelessness Day and World Mental Health Day on October 10th. The Canadian Mental Health Association of Ontario is reminding the community that housing is key to the recovery for many people with mental health issues. Individuals with serious mental health conditions frequently identify income and housing as the most important factors in achieving and maintaining their health. Studies show that people who are homeless are more likely to experience compromised mental health and mental illness than the general population. According to the Mental Health Commission of Canada, between 25 to 50% of the homeless population in Canada live with a mental illness or illnesses. The COVID-19 pandemic has exacerbated existing gaps in housing, making it even more difficult to find and maintain affordable housing for people living with mental illnesses and addictions. The Canadian Mental Health Association of Ontario continues its efforts to promote the need for housing in general and supportive housing in particular for people who experience mental illness. The Canadian Mental Health Association of Ontario has called for increased investments in housing, as well as the need to reduce barriers to housing as one way to reduce the overall cost to healthcare, police and justice, and social services sectors. We were underwater before, but now it's literally a tsunami, says the region's mental health provider. The Canadian Mental Health Association of Waterloo Wellington is calling for more funding to deal with the 35 to 40% jump in demand for mental health services since the pandemic started. As of Wednesday morning, 3,824 people are waiting for mental health care in the Guelph, Wellington, and Waterloo regions. All of these people have completed an assessment with the Canadian Mental Health Association of Waterloo and Wellington. However, due to a backlog, these people are waiting for access to services and ongoing care. This figure does not include those who have called in crisis, as those called are responded to immediately. Helen Fishburne, the Canadian Mental Health Association of Waterloo Wellington CEO, said the pandemic completely changed the baseline in mental health and addictions, pushing the estimated 1 in 5 Canadians who will personally experience a mental health problem or illness into irrelevancy, as she believes that number is creeping closer to 4 out of 5 Canadians. That's not to say that 4 in 5 Canadians have a disposable mental health condition, but you look at the level of disruption, the level of distress, and the significant impact COVID-19 has had on people's lives, said Fishburne. The Canadian Mental Health Association of Waterloo Wellington is calling for further action from the Ford government, which includes increased funding to address the gaps in the budget which allow for mental health funding to slip through. For the past 18 months, we have had people calling us that have never ever needed to reach out for help before, and thousands of people, so that is the new normal for mental health and addictions, said Fishburne. We were underwater before, but now it's literally a tsunami. The government needs to fund a full comprehensive mental health and addiction system in Ontario to be able to support those changing needs, said Fishburne. A fully funded mental health and addiction system, according to Fishburne, would see funding going toward a system of care similar to what is seen when someone is diagnosed with cancer and receives care coordination and access to someone who can alleviate and help with the treatment plan by connecting the pieces of care. They have someone that acts as the glue in their treatment plan and connects them and all of the pieces of their care together. We don't have that in the mental health and addiction system, said Fishburne. If there is a particular piece of news or a video you would like to comment on, please feel free to do so on my channel. And again, if you know of anyone who is ongoing through a difficult time and is in need of help or support, I am here for them. As always, thank you for watching. Take care, and I'll talk to you again soon. Bye.